Welcome to our session. The title of our session is Community Mental Health Models, Harnessing the Community for Better Mental Health. And I am joined by my co-panelists, Daisy Rosales and Rosemary Gathara. Before we start our panel discussion, we'd like to just share a few slides with you, but I promise there won't be too many. But I wanted to first just give you a little bit. Oops, I'm trying to. Oh, of course, sorry, excuse me. I'm trying to change the slides, but of course, there we go. Sorry about that. So I wanted to just give you a little bit of an overview about our talk today. What are some of the themes we hope to cover? So we will be discussing during the panel discussion a little bit shifting the focus to only from clinical settings, but talking more about the community as an intervention when talking about mental health. And we'll be talking about how to support community members so that community mental health approaches are most effective. We'll be discussing community mental health interventions, promoting agency and independent living. And discussing although the three of us are huge advocates of community mental health approaches, we know that they come with challenges, and we'll be, talking about some of those challenges and how to overcome them. Last but not least, looking forward to some questions from the audience and some closing remarks from panelists. So I want to first just introduce myself briefly and how my work connects to this session. I am Erla Magnúsdóttir, and I will be facilitating this session. My sort of official job title is Basic Needs Mental Health Coordinator at CBM UK. CBM UK is an organization working on global disability inclusion, but my role is solely focused on mental health, and I've been working on mental health, both global mental health, community mental health, for over a decade now. I'm also a member of Catalyst 2030, the mental health collaboration, which is co-facilitating this conference. So just to introduce very briefly some of my work. So at CBM, I wear many hats. Definitely one of my favorite ones is facilitating the Basic Needs Network, which was founded last year. But Basic Needs has a much longer history. It was a mental health organization founded by Chris Underhill, who gave the keynote address earlier today. And Basic Needs used to have operations in 12 countries. Long story short, these different countries became independent organizations. They wanted more autonomy, but they still saw value in coming together as part of a network. Hence, we established the network last year. So this photo here was taken from the launch last year. And most of the individuals here have tremendous experience working on community mental health interventions in their sort of respective countries. They have all, in some way or another, implemented the Basic Needs model, which is a community-based holistic model. Today, I won't go into detail of it, but I will put some more resources about it in the chat function later. But I want to now introduce my co-panelists, Rosemary Gathara. Rosemary is the CEO of Basic Needs Kenya, but she's actually also a member of the Basic Needs Network that I just introduced. So with no further ado, Rosemary, over to you.
Thank you, Erla, and hello, everybody. As you've heard, I'm Rosemary Gathara. I'm Executive Director, Basic Needs, Basic Rights Kenya, and a member again of Catalyst 2030. So I'll talk a bit about what Basic Needs does in Kenya. So we are a community mental health organization. The next slide, please. Our focus our vision is for people with mental health to live and work successfully. People with mental health conditions and their caregivers to live and work successfully in their communities. So we do know they do need care in health facilities where necessary, but most of the recovery happens within their communities, and that's what we advocate for. So our interventions include having empowering caregivers to provide the care the care that they need within their communities. We also have programs that empower people with mental health conditions to have better livelihoods. Of course, they and their families to have better livelihoods. On the next slide, please. And thank you. And of course, increase access to available and affordable mental health services for recovery. So yeah, that's briefly some of our work, and I'm happy to be sharing the experiences that we have promoting community mental health. And over to Daisy, please.
Hi, everyone. It's a pleasure to be here. I'm Daisy Rosales. I'm the co-founder and executive director of BRIO, and I'm calling in from California on the west coast of the United States. Slide, please. And so BRIO works in the space of mental health promotion. We believe that mental health is more than just a risk area or a vulnerability. It's a resource for people to live lives that are meaningful to them. And so how we do that is we partner with extraordinary local organizations of all sizes to design scalable mental health programs that build psychological flexibility. It's a set of 6 mental processes. If you've heard of acceptance and commitment therapy or training, or ACT as it's called in the industry, it cultivates this internal resource called psychological flexibility. And we work in Latin America, parts of Asia, and the United States. And so some of the key things that we do are, as I said, we collaborate. All of our work is through collaborating with local organizations that see mental health as really important to their mission as part of the impact that they want to have. And we focus the design process on the community's vision of flourishing, which I'm excited to talk a little bit more about today. And then in the process of taking effective initiatives to scale, we help our local partners with training and resourcing so that these initiatives can go far beyond their own communities into others that have similar challenges and hopes. And finally, we share about all of the work that we're doing and hoping to provide materials and resources for others who would like to do this type of work. Next slide, please. And so just a final slide in terms of the ultimate vision, we believe that mental health is really necessary for liberation, to experience freedom in a range of circumstances, particularly that are difficult. So we think about living meaningfully in the midst of hardship, and also doing so through local systems, particularly education, workforce development, and leadership initiatives. And thus far, we've reached about 10,000 people directly. So I'm excited to dive into this conversation with Erla and Rosemary today. And thanks again, everyone, for being here with us.
Thank you so much, Daisy and Rosemary. I have put our email addresses here, but we can share those later in the chat as well. So don't worry if you can't catch them now. I'm going to stop sharing my screen now. Hopefully that worked. So I'm looking forward to the panel discussion, but I thought maybe before we start, I'm going to invite everyone just to take a moment to think about a community member that you are grateful for. And you can define community in different ways. It could be someone living close to you. It could be, a family member in a virtual community. But just, because this session is really about honoring the community and the power, harnessing kind of the resources that are within the community. So I'm going to invite you to take just a minute to think about that. If you feel comfortable to share the name of the person you're thinking about in the chat, we would love that, but no pressure at all. So just take a minute now. Thank you, everyone. We will now, I'm going to ask the panelists, Daisy and Rosemary, a few questions about their work. So I want to start by just exploring this idea of shifting from the clinical setting or focusing only on the clinical setting to thinking about the community as an intervention. If you could tell us a little bit, why do you think it's key to make this shift in your context where you work? And if you can give us any examples, that would be even better. So maybe Daisy, if it would be okay if I start with you, asking you about your experience with Brio on that.
Yeah, I think that many of us who are here talking about mental health, we think of mental health as multidimensional, and it shows up transversally in the various worlds where we engage. And in many ways, mental health is a way that we can respond to the hard things in life, the pains that life gives us, whether that's relational or health related or community or related to the society and the structures that we live within. And so mental health is relevant far beyond the medical setting. And for us, we try to work with local organizations that are supporting marginalized communities, particularly because many of those leaders and organizations are already confronting some of the most painful human experiences that can exist. And so mental health is incredibly important in those spaces, whether they're seeking to improve education for rural kids in government schools, or they are working to advocate for human rights and justice among families of disappeared people, families who've experienced violence. Or maybe they're working with at-risk youth who are constantly being recruited by gangs to participate in those activities and trying to support them in making choices that reflect who they want to be in the world. These are critical and really difficult spaces. And so I believe that if we were to have mental health programs and initiatives and awareness in those spaces, we can help people to experience some of that stability and some of that willingness to continue to show up for their lives when the responses that are natural to us are to fight or to flee or to freeze, and to bring some of this wider range of possibilities to those spaces. So I'll kind of open it with that. It's just, I think mental health is incredibly relevant in places where there's pain and marginalization and injustice. And we need to bring mental health directly to those spaces rather than keeping it just in the clinical setting.
Thank you so much for that, Daisy. I'm going to hand over now to Rosemary, and if you could kind of respond to the same question. Just before I do that, I do want to say to the audience, I forgot to mention, please do post your questions when they come. You don't have to wait till the end. And, we'll definitely address them to them, but maybe sooner if that is more relevant. But Rosemary, over to you.
Thank you, Atla. Yes, what Daisy has said resonates here as well in Kenya. We have, I'll also add and say the health system for us, for mental health, is woefully inadequate. There is very little mental health support within the health system. The focus has mainly been on communicable diseases or basically other, the issue of malaria, HIV. That's where the most focus has been, and that's where the resources go. So the resources for mental health are very little and mainly focused on institutions, so psychiatric hospitals. So there's a lot of stigma. People do not see these institutions as places of recovery. In fact, it's a threat to be told that you'll be taken. Our national mental health hospital is called Mathare, and anytime you hear someone say, you'll go to Mathare, it's more punishment or a more, yes, something wrong, not a place of recovery. But communities, on the other hand, are places where people should feel loved, should feel cared for, and should find the support they need. It's where we get most of our support when you have our day-to-day hardships. It's your friend, it's your schoolmate, it's your workmate, it's your partner, your family. That's how you get most of your support. So that's what it should be for everybody, including for, even people with a mental health condition should find similar empathy and support. Unfortunately, because of this huge stigma around mental health, that's not always the case. then I'll also say in terms of services, why we need to move away from a clinical setting is also because of cost. And unfortunately, there are some really good mental health services, but are very high cost. They tend not to be public in our setting. So there does need to be more skills for people in the primary healthcare, people within communities who can provide the care that people need and the support and the empathy to improve on their mental health and well-being. Thank you, Atla.
Thank you, Rosemary. Rosemary, if I could come up with a follow-up question to you. I remember when we met to prepare for this session, you said something that really stayed with me. You said sort of community mental health is not another way of saying anything goes, because you could see how maybe someone who comes from a more clinical, well, associates mental health with more clinical settings, there are obviously qualifications and there are sort of systematic ways. So what would your answer be to someone who might be newer to thinking about community mental health approaches, and yet thinking how do you make sure that the quality is at a certain standard and so on? I wonder if you could elaborate a bit on that.
Yes, that's true, Atla. Unfortunately, many times people here talk about community mental health and they'll assume go talk to your pastor, or go talk to your priest, go talk to the local, find an elderly person in your community and speak with them. And they assume that's what, that's good enough. But we say there are standards. So the same way you don't just go to any practitioner and they call themselves a doctor, somebody needs some skills, whether it's the basic skills or evidence-based skills, whether it's a problem management plus, whether it's CBT, low-intensity therapies. So we do need people within the communities who have certain skills to promote good mental health. And I'll say community mental health has been abused a lot. We see it abused a lot in the community. We have individuals who are locked up in churches, people who are beaten up with Bibles and told they're demon possessed. We have people like in my community, if I develop a mental health problems, then people start looking back, what did you do wrong? And they'll say, go to the elders, maybe you need to give something, maybe your mother did something, or dowry wasn't paid right, or you went against a certain custom, that's why, and then they say, that's what you need to do. But obviously, that's not what we're discussing when they say community mental health, not that people shouldn't have practice their culture, but that's not it. It's about challenging the stigma, people recognizing that it's a medical condition, it does need care, and there are known methods for providing the care and support somebody needs. So it's about maintaining some quality and ensuring that people who do provide the care have the skills and the supports that they need to provide good care.
That's excellent. Thank you so much for elaborating on that. Daisy, if I could ask you sort of maybe a similar question, because it can sound easy, kind of community, using the community as an intervention, but how do you provide the support to community members to be able to do that? And you were talking about the need for really mental health in all aspects, of everything that we do, and working with some, I know, extraordinary community organization as you do, how do you then support them to be able to provide support, community mental health support?
Yeah, I love this question. And so many things that Rosemary said resonates with me. And, one of the pieces that we start with is within acceptance and commitment training, which promotes psychological flexibility. One of the biggest questions is, what's important to you? What would you like to move toward in your life? And so there's this question of values. And so when we start with talking with community members and leaders and organizations about, what is your vision of the good life? What does that look like? And with the condition that maybe your external circumstances don't change immediately, what would it look like for you to still live a good life? And so when we start to have these kinds of conversations, there's this recognition that, okay, mental health is not just about a maladaptive, response to the pains in life, right? And I think that is frequently how people see some of these problematic behaviors. And first of all, there's an acknowledgement that some of these behaviors are functional. It's about the context. These are the ways that we have learned to deal with pain. And so maybe what we can do is work together as a community to say, okay, what are some other ways that we can respond to the painful things in life? What are some ways that we can help others who are experiencing pain in life in a way that reflects more of, again, our values of where we want to go as individuals and as a community. And so I think what's really important about engaging the community is everything Rosemary said around having the evidence. And so, for us, that's ACT. But, centering all of that on helping people to live lives that they want to live, and rather than saying, oh, wellness looks like this, or well-being is going to be when you no longer XYZ, or when you don't feel this way anymore. No, it's really about, well, given that life is difficult in all of these myriad ways, how do you want to be taking action? How do you want to experience that, your life? And so expanding that range of possibilities and helping people to develop a language around that. Now, when it comes to the actual programming, we do skill building. And so these are psychological skills. These are ways that people can learn to respond to their realities in new ways. There's a strong kind of mindfulness component. And sometimes people think of mindfulness as like, oh, I got to meditate for 5 hours. It's not that. It's being able to kind of notice and acknowledge your own experiences with a little bit more openness and curiosity, and to take some of that freed up energy and moving it toward committed action that reflects your values. And so those are some of the kinds of skills that we try to build with individuals and groups of people.
Thank you so much, Daisy, for that. If I could ask you, just you meant how you're describing it. It's a process. You're working with the community. Do you ever come across resistance in terms of wanting almost like a magic bullet solution? Because what the journey that you're describing, and I think you said even change doesn't happen immediately, and what asking people to vision what does a good life look like for them, but recognizing that might not be immediate. You can't get there immediately. Like how do you manage expectations, and how does that work?
Yeah, that's a great question. I think ultimately, that not to get too philosophical, but part of it is thinking about our values and our vision of flourishing as a horizon, as a chosen direction, not so much a destination on a map where you can arrive and be done, but rather, due north on your compass. What direction is north, and what would it look like for you to go north? And, I think one of the challenges around that is we think about, a lot of us think about mental health mechanistically. It's a very sort of Western way of seeing illness and well-being as, there's something broken, we're going and like tweak that, as you said, maybe like a magic bullet, give me the thing, and then all of my problems will go away, at least in this domain, right? But one of the things that I've learned from both of you and Rosemary in particular, with regard to community-based processes, is that ACT, the process we use, much of the work that community mental health is about is process-based. It's not mechanical. It's about changing the way that we do things. And that's how the community actually becomes part of the intervention, and not just, volunteers or, a good labor force to deliver something. This is about actually changing the way people respond to themselves and each other. And that does take time. But what's exciting about it is that you can do it with anyone. It's not something that you kind of have to wait till you have all the different mechanical pieces in place and press start. You can ask someone today what's important to them and what it would look like for them to move in that direction. And that's what's really exciting about this, is you can start with anyone and with very little cost.
Thank you so much. I resonate a lot with what you just said. Kind of took me back to when I was working on community mental health projects in China, and I remember that shift happening where initially often people wanted a solution and simple, but when they started to take ownership, and as you said, you don't have to wait for everything to be in place. You can start to take actions immediately, and I think that can be really empowering and quite an important realization. No, thank you. Rosemary, I wonder if you could elaborate a bit more. You've mentioned stigma, but when you are working with the community, and it's so important that the community kind of feels ownership and is driving really the work. But how do you do that when there is a lot of stigma, and how do you take things forward in such settings?
Yes, certainly. It is a challenge in the community, the huge amount of stigma around mental health and moral judgments, and people are blamed for not having good well-being. But what we do at Basic Needs is, one thing we found that works really well is empowering people who have a lived experience, and so that they can speak out for themselves in their communities. And we have found that it works so well when we have a training program that we take, and especially for the young people. Kenya is mostly youthful country, 75% are under 35. So we get the youth who are open about their mental health condition, and we train them how to disclose safely, how to have a conversation that doesn't focus on their lowest moments, or how even when they speak in the media to be assertive, what do they want to feature, and if they feel, they only want it to feature once and never again, those kinds of things, so that they can share safely. And then they just talk openly and honestly about their own experience. And we have amazing champions. We have people like Edwin, who's so open. He's a father, he's an accountant, he's a husband, he has children, he has a mental health condition, and he goes on TV and says this, or he goes in his community and holds these conversations, and then people start to see that it could be anybody. And having a mental health condition is you're not defined by only your mental health condition. So when we have more and more people coming out openly, and they do this through spoken word, they'll do it. We have a DJ who does it on radio. As he plays his music, he discloses and he says what he does to manage his well-being, despite having a diagnosis of bipolar. He still goes about his life. And so people slowly, it's starting to change. We do have an upcoming stigma survey in Nairobi. We've done this with over 60 champions with sharing their lived experience. And we're hoping we've moved the needle somewhat, but of course we need a whole lot more people speaking more openly. We've even had politicians come out and speak about their mental health conditions. And we've seen changes also in how mental health is reported in the media. So it's more stories of recovery and more stories of what you can do to promote your well-being. And that despite having a diagnosis doesn't mean you're always having poor mental health. You can have a diagnosis of a mental health condition, but still enjoy a good quality of life and still be able to do your everyday things. So we see, especially having people with lived experience lead, that has worked really well at Basic Needs. It also helps that when we have, for example, the community health volunteers engaged in mental health, when people know at what point to refer, so that when we put in place community health support, that's not the only thing. So we have a movement on quality rights in Kenya that promotes good human rights within the mental health services. So when the community health volunteer has identified a service that works and that upholds the rights of the person with a mental health condition, and they refer people to the right places where people can talk about recovery, then we find it really helps more people come out and acknowledge that they need support for their mental health, and it's not a shameful thing. So we feel that's working well in the Basic Needs program.
Fantastic. And I've had the honor to meet some of the champions that you have trained, and I really sort of wanted to highlight, I think, something you said that I think is very important in terms of how to disclose safely, because it is one thing, isn't it, sharing your story, but making sure that you feel in control of what you share and what you don't. And I know that's something that you have taken great care to think about in your training of champions. So no, fantastic to hear a bit more about that. Daisy, I wonder if I could ask you next, when we met to discuss this session, I think, it was your words, you talked about viewing mental health as a way of promoting agency and independent living. So if you could elaborate a bit more on that and sort of how are you seeing lives changing beyond managing illness or preventing illness?
Yeah, I love this question, again, because it kind of turns the mental health conversation on its head as sort of, sometimes we get stuck in this victimhood narrative of, basically the narrative that I have heard a lot, even amongst those who are working in mental health, is something terrible happened to you. And now, this is something that you have to deal with, and it has all of these negative effects on your life. And as much as it's important to understand the impact of these from a scientific lens, from a humanistic lens, it's also important to have a conversation about, well, how do we help people experience that agency and dignity again? That to actually come forward, to move forward in their lives, even in the midst of having had difficult experiences that may surprise us sometimes, right? And I think what's really exciting about mental health promotion and some of the process changes that we're talking about here is that it helps people to learn that our responses to the painful experiences that we have do not have to be so constrained. It doesn't have to be something that becomes the lens through which I see everything, or the way in which I interact with everyone. And so what I can experience, maybe if I change my relationship with the painful experiences that I have, is that I experience more freedom to choose what I want to do. And so practically speaking, here's one example of what that looks like. One of the reasons, again, that the community engagement is not so much just sourcing a bunch of people to do things, is that it changes the narrative about what's really happening in a community that maybe has experienced marginalization, injustice, violence, poverty, the numerous isms and challenges that we have. Is to say that when the community has participated in creating the vision for an initiative that they actually want to participate in, that reflects their sense of the good life, that's agency first and foremost. So there's agency in the process of creating these kinds of programs to reflect not what we want or even what the organization we're partnering with, what they want, but what their participants actually want. So that's number one for agency. I think the second thing is much more subtle, and it's it's realizing that every time this really difficult memory comes up, every time I interact with this challenge, every time I feel this painful thing that is just in my life, I've actually figured out how to expand the possibilities in the present moment. I can make a different choice than what I did before. And that's incredibly powerful, because even if that painful thing is still there, maybe I can stop struggling with it, and I can make a choice that reflects who I want to be. And then ultimately, the important part is this engages individuals and their communities in actually changing those realities. And so we're not denying the fact that there's these structural issues. We need to rise up and address those. And we've talked about this to some degree, of how mental health reflects to some degree some of these realities that are incredibly painful and oppressive and difficult. But when we can actually think about changing the way that we relate to that, we can come back and say, okay, well, what do I want to do about this? What can we do about this to advance our liberation and freedom? And so I think hopefully what happens is, as people experience mental health at the individual and community level, they can actually take the action required to start to change that reality.
Thank you so much, Daisy. That was so eloquently put. And I see lots of questions, or I see a few questions coming in, which is fantastic. I will make sure to leave enough time for questions, but I will just wait a little bit before we address them. I think both of you have shared so much of some of the fantastic work and, you know, the power of the community and how we can see these processes and changes. But of course, I know that, or you know, we all know that it's challenging. It's not as easy often as it sounds. So I wonder if we could, you know, take a step maybe back and look a little bit about what are some of the challenges that you find in these approaches. It could be real challenges. It could be maybe myths that you know, you find that there's ways around. But Rosemary, I wonder if you could start just describing some of the challenges that you have seen through the years of the work that you do.
Yeah. Yes, of course, there are quite a few challenges in working in community mental health. One of them has to do, I think, something I already mentioned about when people think anything goes. So, for example, in Kenya, there's been a huge emphasis on community health volunteers, and they're the go-to for most conditions. So, for example, about promoting HIV medical adherence to HIV medicines, to TB treatment, they'll administer vaccines for children, and they get to be seen as they are a huge resource in the community. But sometimes people over rely on them, and they're not experts. So somebody could feel that they're seeing this person, and that's all they need to do, or sometimes they're seen as experts beyond what they really are, because they get very little training. I mean, it's one person and all these range of conditions that they're expected to do something about. So it's about being realistic. When we say like this word task shifting, sometimes, unfortunately, it denies people access to professional help that they really need. So when you have an over-reliance on primary healthcare, and then the government doesn't invest as much in providing, because there has to be a referral framework, even as you do community mental health. It doesn't end there. So unfortunately, sometimes it's in as a way of saying, you know, like we've done something about it and that's it. And it's not enough by itself. So there still needs to be a referral pathway even within the community, and sometimes that is left out. We, of course, try to do something about that. Basic needs, we will do expert movement, having somebody, we may not have a psychiatric nurse in every community, but we could move one from a health facility to do monthly clinics within the community. We don't have psychologists within our community, but we can have some from the sub-county hospital come over on a monthly basis and provide the care and support that they need, and even do debriefing for the other community health workers or other lay volunteer counselors within the community. So that's something that we can do something about, but we keep emphasizing it with government that don't just say you've done this, it's not enough. You still do need to provide various levels of care. It doesn't end only with the support within the community. I think I'll mention that for now. Thank you.
Thank you, Rosemary. Yeah, certainly it's needs to continue to push. That's very obvious. The work never ends. Daisy, I wonder if you could share with us sort of any challenges that you have seen.
Yeah, what Rosemary is saying resonates with me a lot. And I would say that the case for the models that we've described is finding ways to reduce the risk, to address things as they come up. And what's exciting about work in community-based mental health prevention and promotion is that, you know, it's the acknowledgement that there is not a large enough mental health practitioner workforce in this space. Heck, we don't have enough in the United States that can really address some of the need. And so what can we do about this systemic structural problem? Well, we can hopefully at least reduce the number of people who need that kind of support. We can meet them early on so that we can reduce the compounding effects of some of these challenges so that, so that things don't become so severe. And I know that that's not super compelling for a lot of people. And so I think that's maybe one of the challenges around this is, we've seen this with COVID-19 in a lot of places. People really struggle with illness prevention and health promotion because, even though we have this saying that an ounce of prevention is worth over a pound of cure, we like the cure. At least in the United States, we love the cure. That is how our healthcare system is built. It's built about curing and treatment rather than, the front end of the work that can actually reduce the amount of treatment you need. But we know that that is how you can really engage people from the get-go and engage whole populations. And so I would say the challenge, and we've all talked about this, is not just we need more funding, but that needs to be said, but the funding needs to go in a direction that actually envisions the scope of the problem, effective ways to address it at the root from a prevention, promotion, and community held way. And to actually see this as not just a mechanistic cost-based pricing approach problem that needs, a cost-based pricing mechanistic solution. It needs something that is process-based, that is whole population-based, and that is skills-based. And that's essentially what we're talking about today. And I really hope that, more of the courageous funders and supporters and advocates out there will, bring along their peers in promoting this way of addressing not just mental health, but a number of the challenges that our world faces.
Thank you so much, both of you. Just to kind of push a bit more on the challenges, what would you say to someone who thinks maybe the scope is too big, maybe, if looking at from a clinical set, you're just looking at one component and that's it. But when you're taking a kind of a community approach, you're looking, as you have described, from so many different, you're looking at the problem or the from different kind of angles and different, and how do you, what would your response be there if yes, say a funder that would find it over ambitious to kind of look at a community intervention that is so holistic? Maybe Daisy, if I start with you. Sorry, I know it's not an easy question.
Yeah, well, first we have, the scope of the problem is huge and we have no time to waste. So that, and, when you think about challenges around mental health, this is ultimately about people's relationship with their experiences and the choices they're able to make. And again, you think about how each choice, how many choices we all make throughout the day, and how important those choices are, how they affect our communities and our realities. This is a really important piece to address if we are going to support the rising up of individuals and communities to changing their own experience, the realities that they have, the external challenges. So, I think around this question of how do we do this? One of the things I really admire about the basic needs model and so many of our partners that we work with at BRIO is seeing people as whole again. I think it's so easy, and even with the SDGs, right? We've got the people part and parceled out into different issues. There's the gender issue, the education issue, and the workforce issue. But we don't experience life as issues. We experience life as whole people. And so this invitation into wholeness, I think, is deeply important. And I believe personally that it will have beneficial effects across all of the issues if we address people as whole human beings. And so I think that would be the hope.
Thank you so much, Daisy. I'm actually going to move on to some of the questions from the audience. So maybe Rosemary, I can direct the first one to you because I see we have quite a few questions and I want to make sure we have some time to address them. Lisa asks, how did COVID-19 affect your community work? So Rosemary, if you could reflect on that.
Yeah, COVID-19 was a very difficult time because, I mean, community is about connecting. It's about people being there for each other. And COVID-19 really disrupted some of this work because then you couldn't, it limited, for example, there are times when we were locked down in Nairobi and you couldn't go to certain counties, or people couldn't visit each other. Basically, one of the things it did do for us in Kenya is bring out the magnitude and the magnitude of the need for mental health services. It's about that time when we had a task force on mental health. We had a movement towards changing the mental health law, which was changed last year. We had a lot of recognition that people need mental health services in a huge way. So it brought forth the need, but it also during the pandemic, during the lockdowns and all, it really impeded how much work we could do, but it also made us think creatively. So we encourage people, 5 ways to well-being. You connect with somebody, even if you can't see them, call them. It was about getting rural people to also see you, even if you can't have a funeral the way we would normally do it, because we would normally have really huge, 100 people attending, 200 people attending, but with the limit on how many people could be at an event to 30 and sometimes 15. We encourage people, you could use online, Facebook, and we had people connect others with their loved ones through this online ways. So there were things that more use of technology to keep people connected when they couldn't do so personally. And more than that, it really highlighted the need for people to take care of their mental health in a way that hadn't been highlighted before.
Mm-hmm. Thank you. Important that was highlighted. As we all saw how mental health has gotten increasing focus since the pandemic. The next question I'm going to read out. So I think this was addressed to Daisy. So what you were mentioning is very interesting, Daisy. Thank you. Something that I'm struggling with is providing support to communities facing ongoing extreme injustice and political oppression. How can we avoid for our MHPSS services to act as a mechanism to normalize and depoliticize violence? For example, when we talk about accepting situations that cannot change, trying to build people's resilience so that they keep experiencing social abuse.
This is a really important question, I think, especially as we talk about mental health as something that happens internally as a response to what's happening externally. So there are a couple of things that we think about and why the piece around mental health as agency for action is really important. It's not a passive, well-being is not a passive thing where it's sort of almost another form of escapism where you're saying, I don't like my reality, so I'm going to kind of go away mentally. It's not that. That's the flight response, right? I think what's really important when we think about mental health is that it's about the willingness to engage our realities. And that, I don't say that lightly. It's really hard. And it's less of a, in our ACT framework, the acceptance piece is less about accepting situations that are just, they're not okay. But rather accepting the fullness of our experience. So it's a wholeness. It's again, that invitation into wholly feeling the fullness of the range of experiences, because when we do that, when we are no longer fighting or resisting our experiences of these pains, we can make clearer choices that are based in what we ultimately want to see happen. Now, I think that, one of the things that can be really difficult about this is that, as we're thinking about our internal pains, we need to have a liberation perspective. And so at BRIO, we bring in perspective of liberation psychology. There's a lot to read and a lot to go in there, but what I will talk about just right now is that there's this process that is called de-ideologizing. And what that means, it's a really long word, but what essentially it means is looking at what we've internalized from these systems and structures that have been designed to oppress us, and to ask these questions about, if this is a burden that I've been carrying, it's a brick that somebody put in my bag that I didn't know was there. What would it look like if I could take that brick out and take my energy, again, some of that freed up energy from carrying this weight of whatever internalized belief or narrative that might be, and move that in the direction of the kind of change I want to see. It's a lot easier said than done, but I would say from a philosophical standpoint, that's what we think mental health ultimately enables. And so again, this isn't just, mental health isn't just about accepting and being okay with your realities. The acceptance is what's happening inside. So we're not fighting our own experiences. We're not fighting our own feelings and thoughts, trying to shove them to the side or kind of trying to block it all out because I can't stand feeling any of this anymore. That's the acceptance piece. But the action piece is what we then are able to do as we kind of build these internal resources so that we can withstand some of the challenges that we face in life. So that's just a glimpse into this, but it's a really good question and one that we continue to grapple with our partners.
Thank you, Daisy. Thank you for answering that so well, which, I know we could talk a lot more about. Yeah, we could talk all day about this question, but I just want to point out that there have, thank you, Lou. I see you put a great resource into the chat. I just want to see what other questions there are. Lou, you say the expanding you mentioned reminds me of Barbara Fredrickson broaden and build theory process. So that's interesting. Thank you for sharing that. Chris Andrea, you mentioned your task shifting is not enough, is an important reminder that working with the community is a matter of tires. Indeed. Lise, you say excellent point, Daisy, about getting people to think about preventative care with mental health. Protective measures and strategies are key. Indeed, yes, we all know that prevention is so important, yet so often too little focus is on prevention. Yeah, seeing people as whole, again, wonderful observation. We have another question here. We have a 5-minute warning as well, but how did the COVID lockdown affect children's mental health? I'm going to open it to either of you to come in there, because, depending on if you feel like you have direct experience of working with children. I know, Rosemary, you've done some work with schools recently, haven't you? So.
Yes, and huge effect on children's mental health. We had a school closed down for 9 months, and there was all these stories about how people were dying and all, so they were home and listening to all these news broadcasts, and it was a very frightening time for children. When schools reopened, there was a rush to catch up so that they didn't lose a year of school. So again, a lot of pressure. So we did see quite a bit, and it helped that we ran a resilience program in schools in partnership with Coston US. And we saw children to speak out that it was how difficult it was with them. And it helps when we are able to have conversations about identifying difficult emotions. What do you do? And there was a little book that the WHO also produced that really helped them gain skills. It was a story about this dinosaur and with friends, this dinosaur and the friends that it had and what it would do when it was feeling sad, and what the friends would do about coming together, talking about their difficult emotions, going to a place where they felt safe, talking to somebody who could do something about their situation. So yeah, it helped to have such resources that help children know how to deal with the difficulties that they were facing.
Thank you, Rosemary. We have 4 minutes left, and I want to end by asking both our panelists just a final question, sort of what's giving you hope these days, or if you share a moment that gave you a spark, what makes the work meaningful to you? And Daisy, if it's okay, I'll start with you.
Sure. I can share just really briefly. I think one of the things that is so exciting to see is when people who go through the programs that we design with them actually make different choices than what they were making before. And at the end of the day, we talk a lot about the inner experiences, what matters to us, how we're maybe the mental, emotional challenges that we may feel, the difficult thoughts and the feelings and the sensations in our bodies. And all of that is so important, ultimately, in my mind, to think about how people are making choices that reflect more of who they want to be. Because that's the freedom we're looking for. It's not just about feeling better or thinking better thoughts, some of those pieces that people think mental health is. It's really seeing people, okay, you said you wanted to be a better parent, coming into this program, and you just told me that you showed up for your kid in a new way. Or with some of the refugee communities we've worked with, they start with saying, I just want to get out of here. I want to get resettled. That is absolutely understandable and natural, and yet not something that is easy for them to predict or control. They come out of the program saying, I figured out how to help a neighbor. I want to serve others. I want to be a resource to my community. And so recognizing, there are so many ways to live a good life, and seeing people actually move toward that is deeply exciting.
Thank you, Daisy. Very well put. Rosemary, if I can invite you just to answer the same question.
Yes, so for me, one of the biggest highlights is when I go to a community and see somebody recognize, for example, in the community mental health clinics that we run, and people who haven't had the care they need, and to hear somebody recognize that today I had an episode, and they understand what was going on in their mind, in their body, and they can describe that to the clinician. They have the words to finally say what it is that was going on. And they could say it even to their family member that this is what is going on with me. So, and then to see for example, one incident, especially for the caregivers who, it's very confusing for them. What am I dealing with? It's not like malaria and I know I need to take them to the clinic, they'll get a jab, they'll get tested. But for mental health, for many people, it's very confusing. How do I help? And some, like we had this particular father, and he would say he used to lock his son, not because he hates his son, but it's what else does he do? He has to fend for the rest of his family, but he doesn't know what to do about his son, doesn't want his son to be hurt if he's out there and others don't understand. But you hear him describe that his son needs this type of medicines. He now understands what that is. Before, he would take him and have him admitted in a mental health hospital, and then that was it. And he would only take him up because he didn't have enough money to continue paying. But now to hear him say, no, he doesn't have to. We go for the clinics, he gets his medicine or the injection, and then we can live with him. And these are the triggers, and this is what we avoid, or this is what we can do different to support him to feel better even when he's at home. So to see so many of such experiences for me is quite fulfilling. Thank you.
Thank you, Rosemary. And I see we just have a message from Mark. Yes, I think that is all for us. Thank you so much for joining this session. It's been an absolute honor to be here with Daisy and Rosemary. Thank you, everyone. I hope you have a good rest of your day.